Hi, good afternoon everyone. My name is Nur Aina Suhaila binti Jamali and my partner is Nur Amira binti Hazman. Today my group and I will present about the rising cases of influenza like illness or ILI in Malaysia. This topic is important because flu cases are increasing especially in school and kindergarten. Influenza-like illness is becoming more common in Malaysia. Recently, we have seen many clusters happening. A cluster means many people in the same place get sick at the same time. This situation is worrying because school and kindergarten have many children in close contact. So, early detection and quick action are very important to stop the flu from spread. If we detect early, we can protect children and the community.
My name is Nur Amira binti Hazman and I will continue the presentation with the background of the topic. I will briefly explain why influenza is important to look at today. First, influenza is a contagious respiratory infection that spreads very quickly, especially in crowded places like schools, workplace and public areas. Second, after the pandemic, we are seeing more social interaction and movement combined with seasonal changes. These factors have contributed to an increases in influenza cases. Lastly, influenza shares similar symptoms with the COVID-19 such as fever, cough and sore throat. Because of this overlap, proper testing is essential to make sure patients receive the right treatment. These points show why influenza remains a relevant public health concern today.
Next, central idea. The central idea of our presentation is very simple. To reduce the spread of flu among kids, school must improve hygiene practice and monitoring. The main message is detect early, act fast. If we detect flu cases early and take fast action, we can stop small outbreaks from becoming bigger. Early testing can help control the situation before it spreads to more students.
Thank you to Aina. So, this slide presents the top 5 states in Malaysia with the highest number of influenza clusters. The purpose of this chart is to show how the 124 total cases are distributed across the selected states and to identify which states contribute the most to the overall number. To introduce the data, the chart covers influenza clusters reported in Kedah, Johor, Penang, Kuala Lumpur, Putrajaya and Selangor. In terms of the trend, the number of cases increases progressively from one state to another. Kedah reports the lowest number with 5 cases, followed by Johor with 9 cases and Penang with 15 cases. The number rise again in Kuala Lumpur and Putrajaya, both recording 26 cases. Selangor shows the highest figure with 43 cases, making it the most affected state. This upward trend likely occurs because states such as Kuala Lumpur, Putrajaya and especially Selangor are more densely populated and have higher level of daily movement and social interaction. These factors make influenza transmission more likely, explaining why the number increased and Selangor ends up with the highest total.
Next, bar chart. Based on this chart, we can see the number of influenza cluster reported across different education institutions in Malaysia. First, kindergarten recorded 15 cluster. This number is quite moderate because younger children are usually monitored more closely and class size are smaller. Next, primary school show a higher number with 26 cluster. This increase may be due to large student population and more interaction among students. The highest number of cluster is seen in secondary school with 32 cluster. Teenagers move around more, attend more group activity and mix between classes, which increase the spread of influenza. Lastly, private school recorded 9 cluster, which is the low among all categories. This could be influenced by smaller classes or strict health measure. Overall, the trend show that influenza spread more easily in bigger institutions with higher student movement. This highlight the importance to proper hygiene practice, early detection and effective school health policy.
Thank you to Aina. To conclude, it is evident that influenza cases in Malaysia are increasing at a concerning rate. This upward trend highlights the urgent need for public health intervention to prevent further escalation and protect vulnerable communities. Fortunately, the spread of influenza can be effectively controlled through timely and coordinated efforts. Early testing, consistent hygiene practice and collaboration among parents, schools and health authority are essential measures to curb transmission and safeguard public health. By prioritizing this strategy, we can collectively reduce the impact of influenza and foster a healthier, more resilient society. To sum up, influenza cases in Malaysia are rising fast and need quick action. We can stop the spread by testing early, keeping clean and working together, especially parents, schools and health workers. Let's all do our part to stay safe and healthy. That's all from us. Thank you.